Thanks. All right, well, I see it's 2:30, and I do want to go ahead and, like I mentioned just a couple of minutes ago, I'd like to go ahead and at least start the webinar. I'm not going to take up very much time right now, but my name is Pamela Lowe. I am the Senior Director of Development here at the VCU School of Nursing, and so it's our team, our Development Alumni Relations team, and if you have on your screen, you may be able to see Sydney Taylor and Amber Yancey. If you don't mind giving a quick wave. It's really our team who has been putting on a series of virtual events really since the pandemic started, and just really pleased to be able to present today's event to you all. So today is Accepting the Call, Nurses' Ethical Obligation to Confront Bias and Inequity in Healthcare and the Profession. And just really appreciate that you all were able to join us for what is just a very important topic. And before I go any further, I want to do a quick check-in with Sydney just to see if our dean has joined us yet.
She has not hopped on quite yet, so, but I will let you know.
Okay, well, no problem. Dean Giddens does plan to pop in, and I know that she'll like to say a quick hello. So what I think I'd like to do from here is just go over just a couple of housekeeping items. And for those of you who are pretty familiar with using Zoom, you'll know that we have a chat box feature, which you can click on the chat at the very bottom of your screen, which then that'll pop up a screen over to your right. So just encourage you all to use that chat box. If we don't know who you are, feel free to type in, say hello, what's your affiliation that you might have with VCU or the School of Nursing, or that you might want to have. Say hello to colleagues as you're flipping through, and you might see folks there that you want to say hi to. You can also send a message to myself or Amber or Sydney, if you maybe think of a question that you would like to ask during the presentation that you might want us to be able to ask on your behalf, we're happy for you to send us a private message in that way. And also, we just ask that you all keep yourselves muted during the presentation, if at all possible. We're scheduled to go until 3:30, but we have a full schedule, so it's possible, because we did have several folks who submitted questions ahead of time, that we might go over just a few minutes. If you're able to stay on, feel free to do so. If you need to pop off, we completely understand. We are recording today's webinar, so you will have a chance to view that, and we will send a link out to you after that. So I'm going to do one more quick check to see if our dean has joined us yet, Sydney. Okay, it doesn't look like she has. So Dr. Barksdale, I'd like to hand things over to you, and maybe before we hand things over to our first panelist, we can do a final check-in just to see if Jean's been able to join us at that point. So from here, I'd like to introduce Dr. Deborah Barksdale. She's our Associate Dean of Academic Affairs here at the School of Nursing. She's going to facilitate and moderate today's webinar. Dr. Barksdale.
Thank you, Pam, and thank you so much to all of you who have joined us for this very, very important conversation that we will have today. Accepting the Call, Nurses' Ethical Obligation to Confront Bias and Inequity in Healthcare and Society. It's a weighty title, and it's also a weighty charge to nurses. The ANA Code for Ethics for Nurses clearly states in Provision 8 that nurses, and I quote, collaborate with other health professionals and the public to protect human rights, promote health diplomacy, and reduce disparities. This includes, as articulated by the VNA, advocating for patients and communities, speaking out against racism, discrimination, and injustice. Also, the ANA and the American Academy of Nursing challenged us in their position statement released on August 20th to champion equity, to uphold dignity, and I add to uphold human dignity and to respect individuals. Then there are workforce issues, the diversity of the workforce, who and how we educate, and how we exercise our ethical obligation to obliterate bias and racism within the profession. So we are pleased to have 3 speakers today with us who will help us to think through many of these issues and how we as nurses can have a collective impact to confront these issues in healthcare and in our society. So I would first like to introduce the 3 speakers to you. I'm going to share a brief bio. We have Judy Collins, who's beloved in our school. Judy is also a fellow in the American Academy of Nursing, and she was instrumental in establishing the Stony Point Women's Health Center and was a long-time faculty member at VCU School of Nursing until her retirement in 2000. I thought that must have been a mistake because that's like 20 years ago. So she must have retired when she was a baby. She continues to work with the Crossover Health Ministry clinics serving uninsured and medically underserved patients. She's a certified women's health nurse practitioner, and she will discuss her experiences working in community health and how to address bias when working with diverse patient populations. Next, we will have Seneca Bock. Seneca is the founder and chief strategist of Community Capacity Builders, a full-service training and technical assistance and project management consultant agency. She recently served as the co-chair of the Region 3 Health Equity Council here in Virginia. I first met Seneca when we were working together with the National Nursing Action Coalition to increase the number of African American nurses. She will discuss why a diverse nursing workforce is important and how to expand opportunities for Black nurses. Next, we have Dr. Tamara Broadnax. Tamara is a 2-time alum of the VCU School of Nursing, so we're really proud of her. She currently serves as president of the Central Virginia chapter of the National Black Nurses Association. She is a board-certified nurse executive advanced, and she has expertise in leadership and new program development and implementation. She has been involved with health equity legislation at the local, state, and national levels, and she currently works in the Clinical Command Center at the Central VA healthcare system and sits on the VNA, Virginia Legislative Nurse Action and Diversity Virginia Legislative Nursing Alliance and Diversity, Equity, and Inclusion Council. Broadnax will discuss her role as part of the National Black Nurses Association and why nurses play an important role in health policy. So as you can see, you're in for an extraordinary afternoon. So before I turn this over to Judy Collins, I'd like to check to see if Dean Giddens has joined us. Dean Jean Giddens? Nope. Okay, so we will move right along and pass this over to Judy Collins.
Thank you so much, Dr. Barksdale. And good afternoon to all you Zoomers, our new word as we're all dealing with this during the pandemic. I really appreciate the opportunity to share some thoughts about this intersection of nurses and our ethical obligation to confront both bias and inequity, as well as our role in promoting social justice. And as was shared with you, my contribution will be to the panel is to chat about Some of my practicing role as a nurse practitioner in Crossover Healthcare Ministry, which is a safety net clinic that started over 30 years ago in the Richmond area. And I'd like to add that there are 3 VCU faculty members who also practice, and they are Leanne Breckenridge and Allison Gregory, as well as Nancy Jallo, as well as the fact that many students come, both undergraduates as well as graduate students. So it's been a wonderful opportunity to share how nurses can work in this role. And as we move ahead, I'd just like to share with you that you will see the Crossover Healthcare Ministry, and the underline really fits in with what the Code of Nursing is, and that is compassionate healthcare for all people in need. So to just give sort of a quick overview, a brief overview of Crossover, I think it will help you to see where we are and how we are trying to serve the underserved that Dr. Barksdale talked about. So the first thing to look at is Crossover's mission and vision. You will notice that our mission is to provide high quality healthcare, promote wellness, and connect community talents and resources with people in need in the name of Jesus Christ, with a vision of a healthy and vibrant community where every person is restored by the compassionate, healing love of God. You will notice that that's very faith-based, which has been the beginning and the founding of Crossover over 30 years ago. But the whole goal is to meet people where they are with not only the compassionate care, but this is really regardless of their race, their color, their creed, their religion, or whatever they bring to us. So you will see of who we serve. And those that we serve are the uninsured population, patients with Medicaid, which has just been added since Virginia expanded Medicaid. And what has been the thing that Crossover has done for years is patients with incomes at or below 200% of the federal poverty level. And if you look at that, you will understand how low it has to be for people. If you have a single adult, less than $25,000 plus a year, or for a family of 4, less than $52,000. Those people are served and only asked to do a copay if they can. The one that I want you to really focus on is the large immigrant population. We serve patients at Crossover from over 100 countries and those that speak over 50 languages. With this large immigrant population, there's a huge need for not only equity and honoring diversity, but needing for cultural competency. Some of the ways that Crossover has done that is Dr. Mike Murchie led us in doing a protocol booklet that lists the major countries that we work with and looking at the major health issues, and also a view of how their religion, culture, norms will impact the care that we provide to them. Some examples that I have noticed while working there is that one of the things that we found out is that in some cultures, you really cannot use a family as an interpreter, because when you're using them, they don't like to share bad news or anything that's difficult for the person to hear. So what has happened is that we have a language line. So if we don't have somebody that speaks the 4 major languages, English, Spanish, Portuguese, and Arabic, then we have a language line to use. One thing that I thought was really interesting is that we have a dentist, dental hygienist, and dental assistant. And we really stress oral hygiene, which is huge in these immigrant patients, and also those from the Richmond area. And many of them do not practice good oral hygiene. And many countries, that's not something they've done. One thing that we've seen over and over, and you would know in my area of women's health care, that women want a female provider. And so fortunately, we are able, for the most part, to really provide that for them, especially when it has something to do with women's health care, where they do not want the men around. Also, one of the things that we really, really do is not have any judging. We wrap the people in love and care. And this is, whether this is a young girl who has been sexually assaulted coming across the border, or those that are in the Richmond area who are dealing with domestic violence on an ongoing basis. As we look at some of the models of care, you'll see that equity and inclusion is really important. This may be too small for you to see, but I think you heard in the beginning that we will share these slides with you so you can see a little bit better. But one of the things that we like to do is see the patient in the center, and then you'll see all of the areas of care around that. Everywhere from primary care, specialty care, dental care, vision, women's health, behavioral health, which is, by the way, huge right now, as well as health education, HIV/AIDS, and one really important piece is the whole work of social work. What we found over and over is the ACEs, adverse childhood experiences and events, are amazingly important for us to integrate into our care. And I think that's where equity and justice come along, because we're able to honor these social determinants to try to help them move on to health. Crossover's focus and core mission is healthcare, but through work with the community, we refer people for other things like food insecurity, housing issues, etc. Obviously, going back to our own Florence Nightingale, who knew that we have to have a healthy place to live, good water, and good food to be healthy. Just a real quick look at the program by numbers. You'll see that the total number in 2019 that Crossover served was 6,679. And we don't have time to go through all of these numbers, but you can imagine if you're looking at people that are coming from that many different countries with those many different languages, how you have to really integrate social justice, equity in everything you're doing, as well as honor who they are and being culturally competent. The next slide, which will show you even more of a breakdown, where we've started looking at this, is people's medical home. So we've kind of used this little pictorial to show the medical home and how we bring people to it. So if you're interested, when the slides come, you can see how it breaks down of how many people we're seeing in each of the areas that we do serve. And the next thing is to look at a piece that was developed by Crossover when all of the issues that we have been dealing with in our city and in our country, and that is Crossover's commitment to racial justice. At Crossover Healthcare Ministry, diversity is a fundamental value. We celebrate difference and work diligently to create spaces of welcome for patients, employees, volunteers, donors from many racial and ethical backgrounds. You know, like all organizations, I'm sure that we've all been involved in nursing, we do this work imperfectly. We fall short in ways we can see and in ways we have not yet to learn. But we are committed to the work of racial justice, both internally at Crossover team and externally in our wider community. Unequivocally, we condemn racism and its particular expression against our Black neighbors. We believe we are called to do justice, and we commit to strive for a more equal and compassionate and caring world. There's actually more to that statement, and when you get these slides, you're more than welcome to expand that. I would tell you, as I was asked to work on this panel that I think, as Dr. Barksdale said, is so important, I had a real aha moment. And that I believe that crossover is really an exemplar of not only equity and racial and social justice, but the other aha moment I had was how we as nurses are both honored and challenged to practice in all settings. I think we've been called as nurses to really meet the challenge. And I think as we go through the rest of the panelists, we'll see how that goes. As I move to our last slide, just to quickly show you, crossover has had to move into a COVID-19 response like every other healthcare facility. And you'll see some of the ways that that has happened. But one of the ones that I might point out to you is the little pictorial there is somebody doing telehealth. And this was when I really did feel ageism, Dr. Barksdale, even though I've been retired for a while, and that anybody over 65 was not allowed to come to the clinic in the middle of this pandemic. And we have been doing testing, and over 41% of our Hispanic patients have been COVID positive. And so what they did was, those who will know, is Mimi Bennett and I have started doing telehealth once a week with our OB patients. And it's been such a wonderful way, as even though we cannot go into the clinic, and a way to show that even in retirement and volunteerism, we can keep giving back. So I appreciate everybody and thank you. And I think I even hit my right time place, Dr. Barksdale and Sydney. So thank you all so much, and I'll look forward to hearing the rest of the panelists.
You did well, thank you. Up next is Seneca Bock. Seneca?
Can you hear me okay?
Yes.
Yes, great. Good afternoon. And once again, thank you for the opportunity to share on the panel with such extraordinary innovators and leaders in the space. I am very happy to be here and share my experience with you. But before I get started, I just wanted to take a moment to talk a little bit about the importance and the history of Black nurses. And I wanted to just sit and reflect on the contributions that they have made, to, number one, to the field, but also to the country. And there is a nurse that I have in mind that I've had the opportunity to work with, and she's considered a living legend. And I think it's important for us to reflect on the contribution that some of these nurses have made, but also their experiences in the field when we are discussing racial justice and social justice. That some of these ladies have actually created footprints for us to follow as we're moving forward into nursing innovation. And so if we could just kind of think about that a little bit in terms of looking back where we come from and then where we are and then where we're headed. So again, my name is Seneca Bock, and I am the Chief Strategist and founder of Community Capacity Builders. And basically what we do is we go into the community when we identify social problems, complex social problems, and then we come together with the community to identify solutions. And we unleash the potential that's within. That's pretty much what we do. And so how did I find myself here working with nurses? Number one, let me say kudos to nurses for all that you do, and that you are willing to work alongside social workers, because we have a lot in common. And I get excited about the work that nurses do in terms of their ability to build teams and harness the power within the teams and then unleash that power. And it's important that we talk about the role of Black nurses and how we onboard them and get them more involved in the solutions into some of these complex problems. And how do we do that? So next slide. So some of you are familiar with this graphic here. And it's a very important graphic that comes out of Robert Wood Johnson Foundation. And many of the groups that we work with in the community around this issue are supported by or receive support or funding from Robert Wood Johnson Foundation. Now, if you take a look at it, when we look at it in retrospect, we were looking at equality. That's where we were. We were focused on equality. And as you can see, equality means that we are trying to get everybody to the same place, okay? As you can see, you have 3 individuals riding a bike headed in the same direction, but yet we have a lady sitting down in her wheelchair, okay? Now, we are moving forward. We're going future. We're headed towards the future, and we are attempting to what? Improve the manner in which we solve problems as we're going forward. So we've gotten to a place in the problem solving process where we now are talking about equity, whether it's health equity, racial equity, social equity, economic equity. And it means that not everybody is going to ride the same bicycle. We have to customize the vehicle in a manner in which fits the reality of each person. So that requires a little bit more work and a little bit more understanding and a little bit more unpacking of the problem so that we can what? Culturally understand the problem. And so we are talking about then introducing class, culturally relevant standards, appropriate standards. And in order for us to really understand our client population as well as our community and being able to separate the two, with the community, in this case, we're talking about a community of nurses. So within that community, there is an ecosystem, okay? And so we have to become familiar with the parts of the ecosystem in a manner in which we can customize the solutions or the problem-solving process around that particular portion of the ecosystem. Next slide, please. Okay, so we have an ecosystem that we are calling, in this case, Black nurses, or we're talking about dealing with trying to provide solutions to a particular what? Complex problem. And one of the pieces of the complex problem that we're all confronted with now is what? We are losing nurses to retirement. And pretty soon, we're going to find ourselves in a, hopefully not a pickle, but we will find ourselves in a situation where we don't have enough nurses. And part of that challenge is that in general, we may not have enough nurses, but even more particular, we will find ourselves with not enough culturally relevant, prepared nurses to maybe deal with, let's say, a particular population, let's say African Americans. So we need to make sure that we can onboard and increase the number of Black nurses who are available, who can fill those voids in the greater community. And so one of the ways that we decided to do this in terms of our complex problem-solving process is that we decided that we needed to create a condition by which or a facilitating entity embedded in the problem-solving process, and we decided that we would work with the AARP. And through that, we created Diversifying the Nursing Workforce, Mentoring for Student Retention and NCLEX Success at HBCU. And we created a summit on top of that, where we convened nursing leaders from HBCUs and other universities who can help inform our understanding of what the problem is, number one, what the needs are, number two, and then how do we bring this community together on top of, now this is going to get interesting. On top of that, we had to have a platform, or a format, a methodology in which we would be able to deliver what we thought would be a solution. And so we decided to utilize what we call the CIM, okay, Collective Impact Model. And that is a favorite model of Robert Wood Johnson, and most foundations today understand that most problems that we are all faced with are complex in nature. And what that basically means is that it has multiple component parts that have to be addressed, but from different angles and different manners in which we do this, okay? So we want to be able to get that taken care of, and we'll talk a little bit about the complex model as we go on. There's 5 component parts of it. Then I wanted to also share with you all that as we are working in this space, how important it is that we continue to talk with one another, we continue to have these sorts of opportunities, and that we continue to try to understand what is going on with our social justice within the nursing profession. How do we confront some of the things that we may be sensing or out there that may be getting in the way of us delivering optimum care? And then how do we create a language by which we can have these conversations in an honest and authentic manner that will result and yield in some sort of problem-solving process. And so I will leave it there for right now, and I look forward to the questions and the dialogue, because as we are moving forward, it's really important that we have these honest conversations, and I look forward to the opportunity to answer the questions that are coming about. Thank you.
Thank you, Seneca. Dr. Broadnax, you are
Yep,
next.
I'm here.
Okay.
Okay. Good afternoon. I wanted to start off and just give you all a summary of the National Black Nurses Association, a little bit of the history and a little bit of what our focus is and how we operate. I'm the president of the Central Virginia chapter of the National Black Nurses Association. And our chapter actually extends 100 miles around the city of Richmond. The National Black Nurses Association was actually founded in 1971. In 2021, we'll have our 50th anniversary. But it represents over 200,000 African American nurses, over 115 chapters in the US, Caribbean, and Africa. Our mission is to serve as the voice for Black nurses and diverse populations, ensuring equal access to professional development, promoting educational opportunities, and improving health. And since 1971, that really has been the focus of the organization. As you learn more about the National Black Nurses Association, I wanted to point out a few purposes and objectives that are relevant to our topic discussion today in terms of health equity. One of our purposes is to define and determine nursing care for Black consumers for optimum quality of care, acting as their advocates. We act as change agents in restructuring existing institutions and or helping to establish institutions that suit our needs. We actually serve as a national nursing body to influence legislation and policy that affect Black people, and we work cooperatively, and we collaborate with other healthcare workers to that end. And we also conduct, analyze, and publish research to increase the body of knowledge about healthcare and the health needs of Blacks. Next slide, please. We offer a number of programs, and the way the MBNA has structured itself over our long history is we actually serve on national advisory committees for the AARP, the Red Cross, NIH, CMS, Joint Commission, and we actually have a seat at the table to advise these organizations about issues that affect African Americans particularly. Every year since 1988, we sponsor a National Black Nurses Day on Capitol Hill, and it really gives our members an opportunity to assemble. We probably have between 300 and 350 nurses from across the country that come to Washington, D.C. We have a full agenda. Every year we provide position papers, and we do congressional office visits and calls during our Capitol Hill days. And that's something that allows us to have that face time with our congressional leadership and to also advance the things that are important to the National Black Nurses Association. Every chapter in the National Black Nurses Association uses a collaborative community health model. And this is the cornerstone of how we operate and how we're involved with our communities. Our members are available in our community to do preventative health screenings and health education to include high blood pressure checks, blood glucose, cholesterol, HIV, cancer, sickle cell, and mental health. And across the country, you'll see that different chapters are out there in their communities serving and having Black nurses out there helping the community. We also publish a journal twice a year, and it's a journal of the National Black Nurses Association. And that allows us to publish peer-referenced health material that's research-based. And a lot of it is specific to our African-American community, but we're very proud of the journal that we're able to publish twice a year. We are the recipient of grants. One grant that sticks out in particular was a $300,000 grant that we got from the Office of Minority Health to provide services after Katrina. And normally when we get these grants, they're spread out among all of our chapters so that we can go into our communities and use those resources. In terms of scholarships, we offer scholarships to student nurses at all levels. So it's not only the undergraduate students, we try to support minority nurses, African-American nurses who are pursuing their masters and their doctorates as well. But that's one of our keystone initiatives, is to offer scholarships every year. Through my appointment as the president of the Central Virginia chapter, I'm also involved locally with the Virginia Nurses Association. So we work very closely with our other nurse organizations. And I'm actually on the Virginia Legislative Nursing Alliance, and we just produced an agenda for Capitol Hill, for the General Assembly. And I'm also on the Diversity, Equity, and Inclusion Council for the VNA as we try to achieve those sort of objectives for the community. Next slide. Very specifically for health policy, the NBNA supports legislation at the national level and also locally. I will tell you that one of the bills that we supported was the Maternal Care Access and Reducing Emergency bill. And that was, the sponsor is Senator Kamala Harris. And in particular, we're paying attention to maternity issues, because the CDC said that in 2018, Black women had a 2.5 times higher than had a maternal mortality rate of 2.5 times higher than white women, and an infant mortality rate that was 2.3 times higher than the general population. So Senator Harris's office realizes that there are some issues with implicit bias, and her bill proposes to create these grants to address the bias in judgment or behavior that affects the clinical outcomes for African American women. And they actually want to provide these grants for training programs in medical schools and schools of nursing, and with particular emphasis on OB/GYN type situations. So they want to make sure that that money is available so that this sort of implicit bias training can be incorporated into the curriculums at these schools for health professionals. They also propose to direct the National Academy of Medicine to study and make recommendations for incorporating the recognition of bias as a clinical skill, and to test all nurses in medical schools to make sure that they at least evaluate the ability to recognize implicit bias, and they're tested on their competency with that. So Senator Kane actually created a companion bill, and I was contacted a few weeks ago by his office to ask to review the language in his bill, and we had a video call last month, and Senator Kane wants to kind of augment some of the things that Senator Harris had proposed initially. And I listed some of the tenets of his particular legislation, and a lot of this is going to help reduce the racial, ethnic, and geographic inequalities in maternal and infant health. So the reason I wanted to highlight these policies is every year through the Black Nurses Association, we champion legislation that affects our community. There are other initiatives that we had this particular year, but I just wanted to highlight some of the areas where I have had some direct involvement and members of my chapter have had direct involvement. And I guess the takeaway is, if you're a nurse and you want to have an impact on policy, if you join a professional organization, whether it's the VNA, the Virginia Nurses Association, or if you join our chapter, we have these opportunities to actually get involved and to explain how things affect our community. And in some cases, we're actually able to help them incorporate things that they hadn't thought of when they're crafting this legislation. And I just wanted to summarize what the Black Nursing Association does. And I'm happy to answer questions about legislation and how we're going to move forward to confront these inequalities. Thank you.
Thank you, Dr. Broadnax. First of all, I would just like to thank all three of our fabulous speakers. You have certainly given us food for thought. I actually have a list of questions that I would like to ask each of you, but in the interest of time, I'm going to start with some of the questions that were sent to us prior to the presentation, and then hopefully we can get through those and get through other questions as we go along. So to begin this, we had a question that was sent in prior to the presentation, and I'm going to read it. And I think Tamara and Judy, if you would be so kind as to respond to this question. It said, how can we best address situations where we think we're seeing a bias toward Black patients? For example, pain tolerance in Black women in labor or postpartum. How can I advocate better for my patients and address a situation that I believe wouldn't happen with a white patient if I can't explicitly pinpoint a provider's potential bias? So, Tamara, why don't you start out with that?
Okay, I think in that particular situation, nurses, obviously we are expected to speak up and advocate for our patients. So if you're in a situation where you observe something that's not beneficial for the patient, we're obligated by our code of ethics to speak up on behalf of those patients. If you know the history of some of the inequality and inequities in healthcare and some of the outcomes that our patients of color are at risk for, I believe most nurses are in a position to speak up and address those sort of issues. And I don't think the race of the individual should be a deterrent. And I think because nurses understand that there are populations that are at risk, that we're obligated to go ahead and speak up and advocate strongly for those patients as we would for anyone else.
Hi, this is Judy, and I totally agree. I had a very interesting experience in my life journey, and I was the first white nurse in the old St. Philip's Hospital that was all African-American patients. So I've had some wonderful education from my African-American colleagues forever. But I think when I totally agree what Tamara said, and that is that I think we all learn to speak up in a particular way. It's learning how to have a crucial conversation. And I think we've been helped a little bit by how we now have to ask patients where they are in their level of pain so that we can share with the provider that regardless, and I don't think it matters the race, that we have a responsibility to provide compassionate care, which includes pain control. So I know sometimes it's hard, especially for new young graduates, but as some of us get more mature, we learn to speak up a little bit more. So maybe we can get a colleague to be a partner with us as we approach, because sometimes the person that we're trying to get to give the medicine for might need a little bit more encouragement.
Thank you both. So our next question says, can we weave anti-bias training into the nursing curriculum? And I'm going to give my perspective, and then I'm going to ask Tamara to also contribute. So as the Associate Dean at the School of Nursing at VCU, can we weave it? Yes. Will we weave it? Yes. I think now we're at a point in time where people are really open to seeing things in a different way. I think most of us have always taught about, at least to some extent, about health disparities and health inequities. But now we have the opportunity to really expand what we're teaching and how we're teaching. And as a matter of fact, our students are demanding it. Our students actually submitted a formal proposal to us about how they would like to see more specific content added to the curriculum related to health disparities, differential treatment, and all of those kinds of things. So we are actively working in the School of Nursing now. We're in the process of auditing our curriculum to really understand what is being taught, how it's being taught. And I really think that it's not just what, it is really how. And then we will work with faculty to assure that everyone is current and accurate in their information, and that they're teaching this information in a way that facilitates understanding but does not perpetuate stereotyping. Okay. Tamara, would you like to add?
Sure. Along with that, during the presentation, I spoke about Senator Harris's CARE bill, and even at the congressional level, there's this recognition that providers need to be trained before they start working on implicit bias and things that they don't necessarily think about. So in order to facilitate that, they are going to earmark funds in terms of grants that they can give to these schools, the medical schools, the nursing schools, all the health profession schools, so that the curriculum can, they can augment the curriculum with training that is specific for implicit bias training. So I just wanted to highlight that even folks outside of the profession realize that there's an issue based on the data, and they're going to allocate funding to help professionals have better training on their way before they start working out in the public.
Thank you. So our next question, how do you respond, or how do you recommend we respond to a coworker who claims hashtag Black Lives Matter doesn't belong in the hospital environment because it's, and I quote, a political issue? Tamara? I'm sorry, Tamara. Her name rhymes with Sarah.
That's correct. Okay. Sydney, if you don't mind, if you could post up a position statement for me. There, right now, you know, there's a lot of sensitivity about Black Lives Matter and this whole movement about police brutality. And we've had some pivotal events happen that have gotten a lot of attention. And organizations, professional organizations, have actually issued statements. The National Black Nurses Association issued a statement, but also the Virginia Nurses Association issued a statement that I wanted to sort of review with you all if you all haven't seen it, because it speaks directly to nurses and how we should advocate for our patients. And I'm not seeing the statement. Sydney, do you have it?
I am not finding it. I didn't have it pulled up, but
Okay.
I can share it with people post-event if that's okay.
Okay. And so I have the statement here, and I'm not going to bother to toggle through my screen, but I don't want to read it to you verbatim, but I just wanted to point out some of the information there. And this statement was put out by the Virginia Nurses Association and the Virginia Nurses Foundation. And it basically says that nurses care for all patients regardless of their race, age, religion, gender, and other status. The Code of Ethics of Nurses obligates us to advocate for our patients and communities and to speak up against racism, discrimination, and injustice. And we must expect that same level of care from the authorities. So this isn't a political thing. They wanted to emphasize that we demand justice for George Floyd and at the end of deaths of Black people at the hands of those who are meant to protect them. As nurses, we see the devastating effects of racism in our community. Systemic racism is a very real public health crisis. And they also wanted to stress that COVID-19 has added stress about the health inequity in the Black community and other communities of color, where higher rates of infection and deaths are being experienced. We as nurses have a responsibility during this time to use our trusted voice to call for change. They also are encouraging all nurses to listen and learn as we work through these issues, and we need to understand what has led to all these needless deaths in the Black community and communities of color. So they have actually offered some continuing education that you can access for free. And there's a module, and if you go out to the statement, you can access it. But the content, or the name of the CE, or the continuing education module, is Social Determinants of Health. The zip code is the most important number on the patient's chart. And they encourage nurses who want to learn more about inequities and inequalities in healthcare to actually take that course, and they've waived the fee for that. So it's free for everyone to increase your base of knowledge. And in summary, they've said that we must also continue to encourage our communities to continue to stay vigilant in the fight against COVID-19, and they encourage all Virginians to wear their mask in public. So the reason I wanted to highlight that statement is this has nothing to do with politics, really. This is where we are. This is our environment. This is where our patients are. And as nurses, we're obligated by our code of ethics to advocate for our patients. So when someone says that Black Lives Matter and all of the things that are happening are political things, you really need to understand the impact on the communities and on our patients. And as nurses, we're expected to speak up and to advocate for our patients. So I just wanted to highlight that particular statement. And if you have a chance, you can go back and access it and access the free training as well. Thanks, Sydney.
Thank you. So now I have a few more questions, but I'm going to try to condense these in the interest of time into one question, and I'm going to direct this to Seneca. We have a few questions that do ask about this notion of what's political, how political many of these issues have become. So not just about human dignity or our ethical obligation, but about it's become political, basically Republican or Democrat. So we have a few questions that sort of encompass that. Within the context of the model you mentioned, the impact model for complex problem solving, you told us there were 5 steps. Can you quickly, in the interest of time, run through those 5 steps for us and sort of guide us in how they may help us in solving some of these problems?
Right, thank you for the question. There are 5 pieces to the collective impact model in order for it to be effective. And so I'll just go over those 5 pieces, okay? So one is when you come together to decide that there is a problem and you want to work on the problem, you have to establish some shared goals, right? You're going to establish some shared goals. And then the second piece is you want to measure and develop a monitoring process and build in accountability. It has to have some built-in accountability. Then the third piece is coordinating backbone entity. So in the case that we're talking about, in this case, it was the AARP. The AARP is a coordinating entity that makes sure that the administrative piece is in place, facilitation and resources are in place to move that group forward. And then mutually reinforcing values. And then 5th, sustainability, that you have to make sure that there's sustainable resources in place. So in this case, they built upon the funding that they received from who? Robert Wood Johnson. It was a 10-year grant. And so that money was already in place to bring everybody together. And I do want to mention, when you put something like this together, it's important to make sure you build inside of that program or that process resources for convening. You're going to want to have lots of meetings, lots of facilitation, lots of Zoom meetings like this, and training, and what I call training and technical assistance, education, awareness, and I add an A to it, A, which is action. So you're going to want to have what we call T. And so those 5 things have to be in place in order for it to work well and in order for it to be effective. And this is a model that's being used again for what? Complex problem solving. It's not just one issue or anything like that. That's not when you bring in the CIM. You bring it in when there's a complex problem that has to be addressed. We have multiple entities coming together to bear upon the problem.
Thank you.
You're welcome.
And I also just wanted to just let everyone know that AARP, Office of Minority Health, Robert Wood Johnson Action Coalition are also continuing this work with Hispanic nurses as well as Native Americans. So they have several. I've been on calls with them 3 times this week because of the different groups. So they're really trying to do their part to diversify the nursing workforce. So thank you for that. So
Awesome.
With that, Pam Lowe, I know we are at our time that I was going to pass this back to you.
Yep, I was just gonna say we are at time. We did say that if there were some other questions though that folks wanted to take themselves off of mute. I haven't received any private questions for our panelists to address. Amber and Sydney, I don't know if you received any. Okay. So that said, sure, if anybody would like to take themselves off of mute, if they have any questions they would like to ask, now's the time.
I don't have a question, but I want to tell Judy Collins, I am really impressed with the crossover commitment to racial justice statement. So she went off her iPad when I said that.
I don't know what I did. Yeah, I'm trying to unmute and I unvideoed, whatever.
That's a bold statement and really impressive.
And I'd just like to add too, it's important to really see if you can join one of the professional organizations that do advocate through General Assembly, and just give it a try. Any number of them, you might want to consider joining them. It's a way to advocate for your client population through public policy and legislation.
So, and I liked the idea, Tamara, when you use the word action, because it seems like right now, what we've all got to do with this whole equity piece is really move ourselves from the concept that we believe in into how we can put it in action wherever we find ourselves, whether it's in a clinical setting, whether it's in an organization, whether it's in education, whether it's working with a student, that we need to think action oriented and how that even rolls out in legislation that we see coming down. So thank you again for the opportunity to chat with all these wonderful new panel members that I got to meet.
Thank you.
Dr. Barksdale, do you have any final words before I close things out?
I just really hope that you've all been inspired to explore, and if there's a way that we can, any of us on this panel can be of help to provide information to you or to assist in any way on your journey in accepting this call, just know that we're here to help, and this is so important for our society and for our profession. So thank you.
Dr. Barksdale, thanks so much for those closing words. And I would just like to add that after this event is over, you'll receive an email from Sydney, which will include a link to a post-event survey. This is your opportunity to share ideas, share your reactions to today's event, and also if this might spur a follow-up event or even series of events related to this topic. So we are here to help provide programming that is of interest to you personally and professionally. Please know that. Also, as we mentioned earlier, we will be sending out an attachment which will include the slide presentation. And Dr. Broadnax, as she was finishing up her answers to her to the questions just a few minutes ago, we were able to briefly put up that statement. But if it's okay, we would also be happy to send that out as an attachment if that works. Okay. Well, we'll be happy to do that, so you all can thoroughly read that over. All right. Well, nobody has any other final thoughts. I just want to say thanks again so much for those of you who were able to join us for the first time today. Please join us again for a future virtual event. We're going to keep these going for the topics that are of interest to you. We really appreciate it. Bye, everybody. Thank you again.
Thank you.
Thank you.